Hi guys, I hope everybody had a great Thanksgiving. I'm sorry you can't see my face, but with me recording myself with a face recorder, my computer doesn't like that and it'll just turn off. So I'm gonna have to do a voice recording instead. But I want to state my name is Miranda Andrews and I am a student nurse at Lake Superior State University. And I am doing a presentation on a paper in my nursing management and leadership class. So this is A Ripple Effect, the broad impact of too few nurses. So before I get started with this presentation, I wanted to give a scenario. This is Lisa. Lisa is a newly graduated nurse and has just finished her orientation 2 weeks ago. This past week, Lisa has done 2 back-to-back shifts. On this shift, Lisa notices that there are only 3 nurses taking care of 21 patients on the medical surgical floor. Lisa knows that she has to take up 7 patients this shift, and she is nervous about the workload. During her shift, Lisa feels overwhelmed and tired from having to answer call bells, administering medications, and doing assignments. Lisa soon misread an insulin dosage, causing her to give the patient 2 units of insulin compared to 0.2 units. Now, some things that can be identified as a gap between the entry-level nursing and management is that maybe Lisa wasn't confident in leaving orientation, or maybe she wasn't given much resources to help her with this fatigue and with burnout or anything like that. Because with this, as stated in my title, it's a ripple effect. You have burnout, and this leads to a bunch of other issues that I'll talk about in this presentation. And I'll address these gaps as well and provide solutions for these. So I wanted to get out of this way. This is my opinion from my paper, is that we need to accept nursing shortages exist. We need to figure out a way to help fix this problem. And it may seem like we can't do much, but we can. We would need to speak up and advocate and provide mental health resources to prevent that burnout and fatigue. And some of the reasons why they exist is because there's burnout, no recognition, there's workplace violence, and working hours. And we need to understand ways to help yourself and myself love the profession and not feel fatigued or burnout. But we also need to spread knowledge that we gain through here to help each other out. So if you have a really good mental health tip for burnout, share it with somebody, and maybe they'll also take that into fact, and that'll help them out. Next, I wanted to get into safety and quality issues for patients. I'm just going to state the issues, and then I'll have solutions near the end of the slideshow. So 5 issues that were identified in my paper is medication errors, patient mortality, length of stay in a hospital, patient satisfaction, and burnout. To start off, we have medication errors. 1 out of every 30 patients are harmed due to a medication error. So thinking back to Lisa's scenario, she almost had 30 patients and she made a medication error. So why is that? That's because they have high workloads, they have noisy environments from people maybe chatting down the hallway or opening and closing the medication room that they're in, or maybe they're just trying to figure something out in the medication room and you're trying to figure out the dosage calculation for the medication. There's also long working hours that leads to fatigue and being tired, especially if you do a back-to-back shift. There's also lack of training. So if there's a floating nurse going onto a new unit that they may not be familiar with, well, they're now going to have to familiarize themselves with new drugs that they've never seen before. They probably have back in their nursing school days, but maybe it's been years and they're just so used to their own unit that when they got floated here, they just don't know, they don't remember the medications. And so they need to be re-educated on it. And then more patients than they can handle. I wanted to tie it back with the high workloads just to reiterate it that Michigan doesn't have a law for nursing caps. So hospitals can put as much patients as they want onto however many nursing staff there are that day. And another thing is that nurses are afraid to report a medication error due to the fear of being fired. This can cause a lot of issue later on. So if they make a medication error and they don't report it, that medication error could be a common one, and it could just keep building up and building up and building up at the hospital. But if nurses do report it, then that gives the nurse managers an opportunity to sit down with the staff and go over that medication error to make sure they don't make that same mistake again. The nurse may be disciplined depending on what happens, but we need to address this issue as well. Patient mortality. So some statistics is nursing workload that increases by 16% has a higher chance of patient mortality. Having an additional nurse can help decrease patient mortality by 8%. There was a study done in Illinois. If they put a cap on a nurse's workload to 4 patients, they saw 1,595 deaths could have been prevented in December 16th, 2019 to February 24th, 2020. I want to state that again. 1,595 deaths in about 3 months that could have been prevented. You need to understand that that's only a few months out of the year. Throughout the rest of the year, that's almost like quadrupled. That's a lot of deaths happening in a year because of patient mortality. But some barriers is that nurses are planning to leave within 5 years or less in Michigan due to burnout, retirement, stress, and just the overall workload. And that's a huge issue. Like I said, that Michigan doesn't have a cap on patients. And just the overall picture, not just one unit has patient mortality, but every floor in a hospital has an increased risk for patient mortality in 30 days. It's not just med-surg, it's also ICU, ER, just wherever you're at in the hospital has that increased risk. And then length of stay. An overview. With how much work nurses have to do, they may not have time to do in-depth assessments and only cover the basics like an overview of all the systems. And then with sepsis, a patient with sepsis needs to stay in the hospital for 20 days compared to a patient without sepsis getting discharged around 8 days. That's a lot more work on the nurses, and also just a lot more money that the patient has to pay, more medications that they have to get, more education that they need to learn about to prevent sepsis again. And then patient satisfaction. Just picture it. You're in a hospital room. You really only have 2 things to entertain yourself, a phone and a TV. Maybe some visitors go by. But the one thing that keeps coming in and out is the workers. People who clean, people who are nurses, people who are delivering your food, people who are drawing blood on you. You notice that. And you can notice all the good things and bad things about it. And when you get that patient survey, you're going to talk about it. And they'll make sure that their voice is heard, and then the hospital will take that, and then we as nurses now have to take that going forward and have to do staff meetings to address it. But to kind of help with that is, did you know, to help with nurses, Johnson & Johnson Foundation and a few other nursing organizations are helping nurses by providing a virtual nurse. Virtual nurses can help with indirect care. So some examples are Inova of Fairfax, a medical center in Virginia, uses the virtual nurse to help wound care consults by taking pictures of the wound, which helps save commuting time by 11 hours per week. The virtual nurse also helps with pain assessments, which help nurses have more time to talk to the patient, educate on topics the patient needs to know in more depth. Along with that is that the pain assessments are going to get more accurate. They're going to be reassessed at the proper time, anything like that. And to kind of tie it back to Sault Ste. Marie, we've all used Epic, but did you know that Epic also has an option where they can have all the patient assignments on there and then distribute it equally so that all the nurses has the same amount of workload. So one's not getting higher amount versus another nurse who's getting just a lower amount. This has helped with charge nurses because this has helped save time by 25%. Then to tie it all back, we have burnout again. And just to give a statistic, 1 out of every 4 nurses plan to leave within 5 years due to retiring or burnout. Burnout can also cause a higher risk of, for the patients, falls, medication errors, gaps in care, and infections. And without the right care, nurses are at risk for chronic mental health problems, a loss of passion for the field, and a continuation of stigmatism about nursing and mental health. The stigmatism is that nurses fear that with their diagnosis or with their mental health concerns, that they're going to be viewed differently by everybody and they may get in trouble. What we need to do is to educate about that and make it not a stigmatism. Now for finances, just some average numbers here. For infections, it costs $7,453 to $15,155 per patient. That's a lot of money. But to get a little bit more specific with certain kinds of infections, here's some other ones. A urinary tract infection, UTI, is $2,088.77. A ventilator-acquired pneumonia, or VAP, is $3,753.23. A blood system infection is $2,323.96. A surgical site infection is $3,822.20. That's still a lot of money to me. Like that is a lot. Like if I were a patient and I had to pay for that UTI and all the medications and everything like that, that's a lot. And then length of stay, that is $73,354.23 per patient. And then medication errors, it's $20 billion annually in 2024. If that was per month, it would still be $1,666,666,666.67. That is still a lot of money. Nursing. With nurses quitting, that costs the hospital $30,000 to $60,000 per nurse that they have to pay out. And for a single travel nurse to work in that hospital, it costs $2,997 on average per week for that single travel nurse. So, some solutions is appreciation. It's a simple one. Saying thank you goes a long way. Appreciate them for the work that they've done in the hospital, that they've been doing. You don't understand what the nurse is going through, and treating them rudely or not kindly can affect them. Another one that I found in my paper when writing my paper is having an added bonus helps with nursing retention. So if you do great in your performance, you may get a little bit more money. That honestly would keep me in wherever I work. Education. You need to reporting medication errors and using that as a tool. Have the nurses just have a staff meeting with the nurse manager and sit down and talk about common medication errors and use it as a learning tool and not something to be feared. And then nurse managers educating floating nurses about their unit. Nurse managers should take some time to educate floating nurses about some critical medications and what you need to look out for, what you need to assess, and what resources that they can look back on if they have a question about a medication and nobody's available to help. And then some other resources, as well as talking about mental health, adequate staffing, and virtual nursing, like the Epic. Not a lot of places have Epic, but we can talk about it. We can find other ways to use a virtual nurse.